Raghuvanshi, the Drug Controller General of India. A very warm and hearty welcome to all the distinguished dignitaries. National health security and pandemic resilience is not born in panic. Rather, it is built in precision, delivered in hospitals and garnered in the quiet hum of laboratories, and nurtured, sustained, and powered by visionary leaders like the Honorable Minister of State, Srimati Anupriya Patel. We are deeply humbled by your gracious presence, Madam, and just as you add meaning to this conclave, we'd like you to please light the ceremonial lamp and infuse into this session and mark the inaugural of what is epoch-making, certainly by your presence. Shubham karoti kalyanam. Shubham karoti kalyanam. Arogyam dhanasampadah. Shatru buddhi vinashaya. Deep jyotir namostate. Deep jyotir namostate. We hope that may this light that kindles bring to life the success stories of your endeavors of making India stronger, a healthier nation, a pandemic resilient nation. Thank you very much, distinguished dignitaries. Following our customs and tradition, it is our honor to now welcome and extend a very warm token of welcome to the Honorable Minister of State, Srimati Anupriya Patel. And to do the honors, may I please request Dr. Rajiv Behel, the Secretary, DHR. Thank you. Well, with those words, now to welcome this august gathering in presence of such distinguished dignitaries, I now invite Ms. Anu Nagar, the Joint Secretary, Department of Health Research.
A very good afternoon. Honorable Minister for State for Health and Family Welfare, Madam Anupriya Patel ji, Secretary DHR and DG ICMR, Dr. Rajiv Behel, Drug Controller General of India, Dr. Rajiv Raghuvanshi ji, Senior DDG ICMR, Ms. Manekshaw Centre, Dr. Nivedita, Additional DG Dr. Sangamitra, dear participants and esteemed guests. It is my privilege and honor to welcome our Chief Guest, Madam Anupriya Patel ji, Honorable Minister of State for Health and Family Welfare. Ma'am, your esteemed presence here today is very encouraging and inspiring for all of us here and the entire scientific and health professionals. Under your leadership and HFM Sir's leadership and guidance, we are constantly progressing towards making healthcare in India affordable and accessible through research and innovation. Our endeavor has been to transform our institutions into world-class institutions, and this conclave is a step towards that direction. I also welcome to this session Dr. Rajiv Behel, Secretary DHR and DG ICMR. Ma'am, this conclave has been conceived by him. We've had similar conclaves for MRUs, HTA, Diamonds, and Center for Guidelines. I also welcome Dr. Raghuvanshi, Drug Controller General of India, and all VRDL delegates and esteemed guests. Ma'am, VRDL is a flagship scheme of Department of Health Research and ICMR. Today, we have about 165 VRDLs in the country, 31 states and UTs have been covered. VRDLs work in close coordination with the central government, the state governments, and NCDC also. They were the backbone of our testing network, ma'am, during the COVID network. Because of their support and expertise, we could quickly scale up the number of laboratories testing for COVID to more than 3,000. From diagnosis, apart from COVID, ma'am, from diagnosis of Nipah in Kerala, Zika in Rajasthan, or canine distemper virus in lions of Gujarat, VRDLs have contributed immensely in various outbreaks. Ma'am, during this 2-day conclave, we are actually brainstorming for institutionalizing a performance evaluation mechanism so as to bring the best of these institutions, share best practices and knowledge, and also deliberate on new ideas for continuation of this scheme for the next Finance Commission cycle. With this, I again welcome our Chief Guest, Honorable Minister of State and Health and Family Welfare, to this point. Thank you.
Thank you, Madam. Ladies and gentlemen, time now to traverse through the remarkable journey of DHR ICMR's VRDL network, transcending from the days of implementation to the challenges conquered and the milestones attained, all encapsulated in this video. May we have the AV, please?
India, a land of diversity and resilience, has faced several viral epidemics in the 21st century: avian influenza and swine flu H1N1, each exposed to limitation in health infrastructure. At that time, the nation relied on just two apex labs, ICMR NIV Pune and NCDC Delhi, for molecular detection. The need for a nationwide diagnostic network became urgent. To address this, the Department of Health Research and Indian Council of Medical Research launched the Virus Research and Diagnostic Laboratory VRDL network in about a decade ago, with the goal of rapid detection and timely response to viral infections. Built on a 3-tier model, the VRDL network today has 165 laboratories across 26 states and 5 UTs, forming a nationwide shield against viral threats. These labs conduct serological and molecular testing, genome sequencing, virus isolation and culture, reducing turnaround time of testing from 7 days to just 24 to 48 hours. Since inception, VRDLs have been at the forefront of outbreaks, from Nipah in Kerala, CCHF in Gujarat, Rajasthan and UP, Zika in Gujarat and Rajasthan, to the unprecedented COVID-19 pandemic. The network strengthens disease surveillance by confirming measles and rubella cases, syndromic surveillance of respiratory infections including influenza, diarrhea, encephalitis and fever, supporting outbreak investigations, and complementing national programs diagnosing dengue, chikungunya, and Japanese encephalitis. When COVID-19 struck, 106 VRDLs along with NIV Pune were the first to test for SARS-CoV-2. India's testing capacity expanded from 106 to over 3,300 labs in just 18 months. Their sequencing facilities tracked variants, feeding crucial data to INSACOG and global repositories. Today, with 55 sequencing labs and 11 BSL-3 facilities, VRDLs are India's backbone of pandemic preparedness. In just a decade, they have tested over 7 million samples, more than 2,534 outbreaks of different etiology investigated across the country, trained 5,800 personnel and published more than 1,000 research papers. The DHR ICMR VRDL network stands as the backbone of India's health security, making the nation resilient and prepared for any pandemic.
After that powerful visual presentation, may I now invite Dr. Rajiv Behel, the Secretary, Department of Health Research and DGI CMR, to please address this august gathering.
Honorable Minister of State, Health and Family Welfare, Shrimati Anupriya Patel ji, Anu Nagar ji, Joint Secretary, DHR, Shri Rajiv Raghuvanshi ji, Drug Controller General of India, Manisha Saxena ji, Senior DDG, Administration of ICMR, all the esteemed colleagues who are here, great virologists amongst us who are sitting in the first two rows, all the 165 VRDLs, their representatives, heads of institutions, heads of the VRDL labs, scientists working in VRDL labs. This is a great opportunity for us to get together. We, as Anuji was saying earlier, we are meeting and we think we should physically meet and discuss with different networks of Department of Health Research. So VRDL, ma'am, is one of those networks. We also have in medical colleges multidisciplinary research units. We have the health technology assessment centers. We have systematic review centers for Center for Guidelines. We have molecular cancer detection centers in medical colleges, as well as MRHRUs, where medical colleges are working with ICMR for rural health research. All this is part of building the infrastructure and supporting and using and also engaging with the medical colleges of the country, not only the institutes of national importance, but including them, but also all the other central and state government institutions, and we hope in the future also some of the best private colleges to be part of not only research but also diagnostics in their own labs. The reason for this conclave, there are three goals. The first is we have done an assessment and evaluation of each of the VRDLs, each of the 165 VRDLs in their three categories, either the medical college level or the state level or the regional level. So there are 11 regional level, 27 state level, and remaining are at medical college level. And these assessments have been very carefully done on data that is submitted by the VRDLs to our NIE, National Institute of Epidemiology in Chennai. And also the research they have conducted, what papers they have written, what new technologies they have worked on, etc. There are many indicators, and based on those indicators, we will present to them, and we have been presenting to them since morning, some of their performance levels. And they are divided into those with gold, silver, and then the ones that are good, and some they are below average. So the idea is to help everybody move upwards in that assessment performance. The second reason why we are here is to understand the challenges that we face in making this even greater under the guidance of Honorable Minister and yourself, as well as the overall spirit of what our Honorable Prime Minister has told us, that we need to become Viksit Bharat. In that case, what I have been saying is that we need every case, any infectious disease in the country, we should know what it is caused by. That for us and for this network would be their contribution to Viksit Bharat, because that is what you expect from a developed country. So any challenges to that we will be discussing and also trying to find some solutions coming from them and from the department side to move this forward. We are also going to chart the way forward as to how we want to expand, not only in terms of numbers, but also in quality and in our activities. The goals of ICMR, one of the bigger ones is Atmanirbhar Bharat and our contribution to Atmanirbhar Bharat by creating indigenous technologies, whether they are diagnostics, they are vaccines, or they are therapeutics or devices. And in that, you will see, ma'am, that we will request you to launch some work that has been done jointly between ICMR and CDSCO in the hope that we will be supporting Indian industry in a way that not only can we handhold them in developing the technologies, but also in validation and evaluation so they can get the approval of the regulator, as well as then making sure that those are procured in India. Ma'am, this network is like in this center where we are in the Manekshaw Centre, comparing it with defense, just like in Operation Sindoor, we had an impenetrable defense, air defense system, where none, whether it was a small drone or a big aircraft, nothing could penetrate. And similarly, ma'am, what we are saying is, this is the shield of biodefense that we have to create, that should be impenetrable by any pathogen, any new pathogen or any modified pathogen. We should be able to find it and then take action against that. We have also decided, ma'am, to expand VRDLs to infectious disease research and diagnostic labs, which means we don't know that the next outbreaks will only be viral. We know that they can also be bacterial, fungal, or even parasitic. And therefore, it is extremely important that we expand the network into both the numbers, but also in the way that they are covering things. This network, all the data from this network is going to NCDC, IHIP portal, so that they can also look at that. New diagnostics, for example, CDSCO, etc. So, ma'am, this is the meaning of this conclave, and that is why we are all here together. We are very pleased that you are able to join us. Thank you very much, and thank you all for being here. Jai Hind.
Thank you very much, sir. And now, ladies and gentlemen, we embark on a journey of some pertinent releases. To begin with, the release of validation portal and standard validation protocols. But just before we unfurl that to you, we'd like to bring to you the background to it. And for that, may I please invite Dr. Nivedita Gupta, the head Communicable Diseases, ICMR, to please take us through.
My sincere gratitude to Honorable MOS, Madam Anupriya Patel, Secretary DHR and DG ICMR, Dr. Rajiv Behel, Dr. Rajiv Raghuvanshi, DCGI, Anu Nagar Madam, JSDHR, and Senior DDG ICMR, Manisha Madam. Just to give you a premise, ma'am, after the COVID-19 pandemic, ICMR started receiving many requests from indigenous manufacturers to validate their diagnostic kits. So we have taken 2 steps for that. First of all, we are today, by your hands, ma'am, we are getting inaugurated a validation portal wherein the manufacturers will be able to submit their request for validation. And there are 3 kinds of requests. First of all, whenever they want to develop something, they come to ICMR to be a joint partner for development. That is one kind of request that we get. Second is that the DCGI refers them to one of the ICMR centers for getting themselves validated before they get a marketing approval. And third is, ma'am, that before the kit or the IVD is introduced into the program, for example, the TB program, the program wants us to do a very thorough field validation of these diagnostic tests. So these are the three kind of requests. So in order to facilitate the manufacturers in India, we have created a portal, and in this portal they would be able to apply, and we would be able to do the validations. Second, ma'am, the validation protocols in India for any IVD did not exist, and anybody would do validation in any way. And the DCGI also did not have any handle to actually check whether the validation has been done with all scientific vigor or not. So in collaboration with CDSCO, we have created standard validation protocols for different kinds of IVDs in India. Today, we are presenting to you 39 such validation protocols, and the list is long, ma'am. We will keep on working on that. But this is a benchmark, and if we validate our diagnostics as per this quality, then they will be at par with international standards and even can go for WHO pre-qualification. So we want to raise the benchmark of quality. So that's the overall premise, ma'am. And I would request DCGI Dr. Rajiv Raghuvanshi to say a few words before we get both these things formally inaugurated. Thank you, madam.
Good afternoon. Respected Minister of State for Health and Family Welfare, Madam Anupriya Patel ji, DG Sir, Dr. Rajiv Bahal, other dignitaries on the dais, friends and delegates sitting in the hall. This is indeed a pleasure moment for me as a head of regulator for this country, because I understand the importance of this particular day and the activity which has been completed and what is going to be released today from a regulatory point of view. We all know, in fact, that how important is diagnosis before treatment for any disease, especially the infectious diseases. And since this domain has become so complicated because of a lot of overlapping symptoms, a specific, very good diagnostics system and process has become more and more important in the last few years, especially since COVID, because we see diseases like Nipah, swine flu, bird flu, and many more, which I may not be very conversant with because of not being from the same domain. But nonetheless, it's important, and today is another day when, ma'am, it has been demonstrated the importance of collaboration, especially if I see between CDSCO and ICMR. This is second very important product coming out of a collaborative activity and work. First was the MedTech Mitra, when we together, along with Niti Aayog, did establish a system for supporting the startups in medical device domain, which also included lots of IVD startups. And this is another activity which is of national and more than national, I think, for the global importance, because looking at the level at which India plays on the global scene in the healthcare domain, I think this is going to be a milestone for all of us in time to come. Under this collaboration, CDSCO and ICMR have jointly developed 39 standard evaluation protocols for high-risk IVDs covering diseases such as arbovirus, tuberculosis, malaria, Nipah virus, human HMPV, influenza, SARS-CoV-2, and many more. This initiative is the first of its kind globally, representing a unique partnership between National Regulatory Authority and a National Nodal Research Institute to create standardized protocols for assessing the performance of IVD kits. These protocols will serve as a valuable resource by providing uniform testing protocols, establishing minimum standards, and defining acceptance criteria for critical disease IVDs thereby ensuring consistency and reliability in diagnostic evaluation across the country. So this all, if you see historically, this all started when the medical device, including IVDs, became part of a regulatory system when the medical device rule 2017 was enacted. And since then, it took some time for us to implement it fully. But I'm very happy to say that today, 100% of medical device industry, including IVDs, because IVDs are part of medical devices, are now regulated. Regulation for many, especially the R&D scientists, feel that regulatory system is actually a kind of roadblock which slows down the process of development. But actually, if you see, regulatory systems are essential and they actually facilitate the growth of the industry. Unless until we have a regulatory system where there is a mechanism of approval which is recognized globally, the product itself is not recognized by the global community. And we have our experience before this regulation was there. These IVD kits were not actually properly evaluated, and there were a lot of quality issues in these products. And the activity which today is getting into the standardized protocols and will be released, these are the activities which would ultimately help this whole system becoming more and more robust, throwing out more and more robust products, more reliable products, which would basically increase trust of both the patients and the caregivers and the practitioners on the products which are developed and produced in our country, which has a global responsibility towards the public health. And I'm sure these kind of activities will help all of us in growing our exports towards supporting the global public health. And that is, for me, one of the more important outcomes of this activity. You will see in short time that how this industry grows, the IVDs. IVD, if you see, more than 90% we are self-sufficient when it comes to the product. But when it comes to the basic reagents, we still import a lot of them. And we just formulate and develop into the kit. But since a lot of scientists are sitting here, my request to all of you would be to put some more focus on developing the basic reagents so that we become fully self-sufficient as a country and keep on marching towards the continual position of being at the top of the whole value chain which is being managed for the global public health support. And with this, I will end here. Thanks a lot. Jai Hind, Jai Bharat.
Thank you, sir. And may I now please request the Honorable Minister of State to kindly do the honors of releasing the validation portal. Thank you. We once again request you to kindly release the standard validation protocols. And we also have the physical copy of these standard validation protocols. Many, many felicitations and a photo up here. And may we also request you to do the honors of the release of the VRDL Bulletin, a quarterly release that shall throw light on the trends of different aspects of virus pathogens in India. Ladies and gentlemen, we are delighted to unveil the inaugural issue of the quarterly VRDL Network Bulletin that shall showcase the achievements of our VRDLs, track the trends of pathogens, outbreak dynamics across the nation. A crucial tool for policymakers and health authorities to understand infection patterns, anticipate seasonal surges, and enable efficient allocation of healthcare resources. Thank you very much. And now, ladies and gentlemen, may we request for the honor to embrace the pearls of wisdom and vision of the exemplary leader. Ladies and gentlemen, please put your hands together as we now invite the Honorable Minister of State for Health and Family Welfare, Srimati Anupriya Patel, to please address us.
Secretary Department of Health Research and DG ICMR, Dr. Rajiv Behelji, Director, Drugs Controller General of India, Dr. Rajiv Raghuvanshi, Joint Secretary, Srimati Anu Nagar, and Senior DDG ICMR, Ms. Manekshaw Centre, all the distinguished participants who've traveled from different parts of the country to participate in this conclave today. A very good evening. I am delighted to join you all today at this National Viral Research and Diagnostic Laboratory Conclave 2025. Ladies and gentlemen, India has taken great strides in building a scientific defense shield against infectious diseases. And our achievements, including the robust response against the pandemic, reflect the dedication of our scientists and the strength of our health research system. We meet today at the Sam Manekshaw Auditorium, a place that carries a legacy of courage and leadership. Just as Field Marshal Sam Manekshaw led the defense of our nation in 1971, our virus research and diagnostic laboratories, or VRDLs, have stood as sentinels in protecting the country during the COVID-19 pandemic and beyond. The VRDL network is one of the DHR's landmark initiatives. And today, we have 165 laboratories across 26 states and 5 union territories, which form a nationwide shield that helps in detecting, diagnosing, and tracking the viral threats before they take us in the grip. During the COVID-19 pandemic, this huge network led by ICMR truly proved its worth. From just one testing laboratory at the start, within 18 months, we scaled up to around 3,300 laboratories. Our scientists helped bring down the cost of the COVID-19 diagnostic kits from rupees 1,600 to just rupees 55, making them among the most affordable in the world. Friends, VRDLs also played a key role in sequencing the virus, validating nearly 1,700 diagnostic commodities, of which 78% were indigenous. Beyond COVID-19, VRDLs have been central to early detection of the outbreaks of Nipah, Zika, and Kyasanur forest disease. 16 VRDLs are now equipped with BSL-3 laboratories to safely study the high-risk pathogens. This ensures that data is not only generated, but also rapidly translated into action. We all understand diseases do not respect boundaries. And under Prime Minister Narendra Modi ji's leadership, India has launched the National One Health Mission, which brings 13 different departments under one umbrella for the first time in the world. And you would be happy to know that the National One Health Institute is also coming up in Nagpur as its nodal hub. 10 VRDLs are now part of the National BSL-3 network under this mission, preparing to detect pathogens of human, animal, or environmental origins. This integration is not just strategic, but it's necessary for the health security of tomorrow. NIV Pune, which is equipped with the country's only BSL-4, played a crucial role during COVID-19, ranging from initiating the testing in the country to isolation of virus that led to the development of the first indigenous COVID-19 vaccine, the Covaxin. To strengthen this force, under the Prime Minister Ayushman Bharat Health Infrastructure Mission, 4 new regional NIVs are also coming up in the districts of Bangalore, Jabalpur, Dibrugarh, and Jammu. So these will ensure that every zone of the nation is now being monitored so that our preparedness is not concentrated in just one location, but it is spread across the entire country. Pandemic preparedness and VRDLs are part of the bigger story. They are within a nationwide ecosystem of health research and innovation where ICMR continues to lead from the front. Let me share a few examples of how science is moving today from the lab to people's lives. India's fight against TB has gained real momentum because of the homegrown innovations. Portable handheld X-ray machines, validated by the ICMR, have taken diagnosis into villages during the intensified 100 Days TB Detection campaign. The Deep CXR, an artificial intelligence tool, which is trained on more than 75,000 images, is now used as a free screening solution in the program. And the CBIO TB skin test, at just Rs 199 per test, offers a far more affordable way to detect latent TB compared to the global options. PathoDetect TM, an indigenous molecular test, gives us accurate results on TB and drug resistance in one go, on par with the global assays. And in drug-resistant TB, a modified BPAL regimen trial has shown cure rates of up to 90% while reducing side effects. Friends, for our tribal communities, sickle cell disease has been a silent burden. Under the National Sickle Cell Anemia Mission, DHR has brought down the cost of rapid diagnostic tests from Rs 300 to just Rs 28 through cost effectiveness study, which is conducted through Health Technology Assessment in India, and the validation of new indigenous technologies by the ICMR network. ICMR's landmark hydroxyurea trial has improved treatment protocols, reducing the newborn mortality from nearly 30% to below 5% today. And through the Bharat Cares initiative, we are tracking disease progression to shape scalable solutions over the next 5 years. This is the scientific backbone of our commitment to eliminate sickle cell disease by the year 2047. The Health Technology Assessment in India has played a crucial role in optimizing healthcare costs and quality under Ayushman Bharat PMJ, benefiting crores of people. Using cost data from 86 hospitals, it has supported the revision of 855 health benefit package. Beyond specific diseases, ICMR has built an innovation ecosystem to nurture the medical technology sector. Centers of excellence at the IITs ensure that advanced technology is utilized to address the health challenges of the country. The innovative platforms like MedTech Mitra and Medical Innovations Patent Mitra, they guide startups as well as the researchers through validation, patents, and technology transfers. Already, more than 600 innovators have benefited. And just last week, 9 new technologies were licensed to the industry partners. This ecosystem ensures India is not only catching up, but also setting benchmarks in health research innovation. And to further fuel this spirit, ICMR has launched the first in the world challenge to make India a global leader in the medtech development. Ladies and gentlemen, ICMR's collaboration with CDSCO to create standard protocols for the in-vitro diagnostics is a world first. These protocols, now publicly available, raise the bar for validation and make Indian diagnostics globally competitive. Several VRDLs are being upgraded as medical device testing laboratories, while the validation portal, which we have just launched today, will make processes faster, transparent, and also industry-friendly. This ecosystem ensures India is not only catching up, but also setting benchmark in health research innovation. As we release the first VRDL bulletin today, we add another tool for evidence-based policy making. Tracking the trends of viral infections in real time will now allow better resource allocation by both the state as well as the central government. The story of DHR, ICMR, and VRDLs is one of the collaboration and innovation in the service of society. From detecting outbreaks to validating indigenous tests, from TB innovations to sickle cell anemia elimination, from setting up new regional NIVs to leading the One Health Mission collaborations, India is building a resilient, self-reliant, and globally relevant health research ecosystem. Each laboratory, each innovation, and each collaboration contributes to the larger vision of Viksit Bharat by 2047. It is the collective effort of our scientists, our researchers, our innovators, policymakers, everybody that ensures India is not only prepared for today's health challenges, but we're also shaping the health future of the country tomorrow. On this occasion, I once again congratulate the Department of Health Research, ICMR, and all our VRDLs for their vision and dedication. With this, I thank you all very, very much for your patient audience. Jai Hind, Jai Bharat.
Our earnest sense of gratitude for your sagacious address, Madam. Ladies and gentlemen, time now to award the unsung heroes of our public health ecosystem for their tireless efforts to decode the invisible threats who turn chaos into control. In recognition of excellence for the fiscal year 2024-2025, we now present awards under 2 categories, gold and silver. Once again requesting all the awardees to kindly ascend the stage from this side, the dais left, and descend from the dais right. May we please request you, Honorable Minister of State for Health and Family Welfare, to kindly do the honors of now awarding the gold awardees. To begin with, the first awardee, Government Medical College, Chhatrapati Sambhajinagar, Maharashtra. Ladies and gentlemen, the medical level VRDL being conferred with a gold award. Inviting now ICMR Rajendra Memorial Research Institute of Medical Sciences, Patna, Bihar, the medical level VRDL, who's been now awarded gold for their performance. And if we may request for some consideration to applaud the exemplary performers, ladies and gentlemen. Thank you very much and keep that going. As we now invite Savai Mansingh Medical College, Jaipur, Rajasthan, the state level VRDL, being conferred gold in recognition of their performance. Traversing through India, up next we have Guwahati Medical College, Guwahati, Assam, the state level VRDL, to be presented a gold award. The next awardee is the All India Institute of Medical Sciences, Bhopal, Madhya Pradesh, winning a gold as the regional level VRDL. Inviting now Jawaharlal Institute of Postgraduate Medical Education and Research, Puducherry, the regional level VRDL. Being conferred with a gold. Many, many congratulations. Inviting next the Government Mohan Kumara Mangalam Medical College, Salem, Tamil Nadu, a medical level VRDL, gracing the days to grab its gold. And the final name in the gold award category, the Government Medical College, Amritsar, Punjab it is, ladies and gentlemen, a medical level VRDL, taking along gold for its performance. We now begin awarding in the silver category. And the first awardee in the category is Dr. Vaishampayan Memorial Government Medical College, Solapur, Maharashtra, a medical level VRDL, being felicitated with a silver award. And up next we have All India Institute of Medical Sciences, Nagpur, Maharashtra, a medical level VRDL, being conferred with a silver award. And only if there is a confusion, yes, they are the exemplary performers, ladies and gentlemen, and we are congratulating them. Calling upon next, Kasturba Hospital for Infectious Diseases, Mumbai, Maharashtra, a medical level VRDL, being awarded a silver award. Inviting now Government Medical College, Surat, Gujarat, the medical level VRDL, being conferred with a silver award. Inviting now Government Medical College, Miraj, Maharashtra, a medical level VRDL. Inviting now Dr. Ram Manohar Lohia Hospital and the Atal Bihari Vajpayee Institute of Medical Sciences, New Delhi, to now collect their silver award in the category of medical level silver awardee. And ladies and gentlemen, I now invite the Armed Forces Medical College, Pune, Maharashtra, a state level VRDL, being conferred with a silver. Our next awardee is the All India Institute of Medical Sciences, Bhubaneswar, Odisha. The state level VRDL. Inviting now King George's Medical University, Lucknow, Uttar Pradesh, a state level VRDL, to be awarded silver. Inviting now ICMR Regional Medical Research Centre, Dibrugarh, Assam, a regional level VRDL, bagging a silver. And coming up next is the All India Institute of Medical Sciences, New Delhi, ladies and gentlemen, the regional level VRDL. Next, we have Saint Gordhan Das Sundar Das Medical College and King Edward Memorial Hospital, Mumbai, Maharashtra, a medical level VRDL. Inviting now the Institute of Postgraduate Medical Education and Research, Kolkata, West Bengal, ladies and gentlemen, a medical level VRDL being awarded silver. Inviting now Zoram Medical College, Zoram, Mizoram, a medical level VRDL being recognized with a silver. And joining us from down south, we have the Madurai Medical College, Madurai, Tamil Nadu, a medical level VRDL, receiving its silver award in the medical level VRDL. And joining us now is Tirunelveli Medical College, Tirunelveli, Tamil Nadu, ladies and gentlemen, the medical level VRDL. inviting now King Institute of Preventive Medicine and Research, Chennai, Tamil Nadu, the state level VRDL. And time now to felicitate the National Institute of Epidemiology, Chennai, ladies and gentlemen, being recognized for their exemplary contribution. Let that be a roaring one, ladies and gentlemen. And now inviting the National Institute of Virology, Pune, being recognized for their exemplary contribution. And that, ladies and gentlemen, is the final recognition in this session. Thanking all the distinguished dignitaries for doing the honors. And a few lines now being dedicated to all the awardees and the performers. I am sure everybody here fits into either of the categories. रघुवेंद्र सिंह की इन पंक्तियों के साथ आपको समर्पित है। देखा तो होगा नदियों को दुर्गम पथ पर बढ़ते, नहीं सुना क्या अभिमन्यु को कुरुक्षेत्र में लड़ते। मैं खुद एक दिन ऐसे ही सागर को ललकारूंगा, चाहे कुछ भी हो जाए किस्मत को नहीं पुकारूंगा, पतवार छोड़ूंगा नहीं, मैं किनारे की तरफ नाव मोड़ूंगा नहीं, मैं किनारे की तरफ नाव मोड़ूंगा नहीं। Ladies and gentlemen, please keep up the exemplary and the good work, the highest ideal of service that you all are in pursuit of. With these words, may I now please invite Ms. Manisha Saxena, the Senior DDG from the Indian Council of Medical Research, to kindly propose the vote of thanks.
Namaskar. Respected dignitaries, Honorable Union Minister of State for Health and Family Welfare, Government of India, Srimati Anupriya Singh Patel, Shri Rajiv Bahal, Secretary DHR, Ms. Anu Nagar, Joint Secretary DHR, esteemed Shri Rajiv Raghuvanshi, Drug Controller General of India, esteemed speakers, principal investigators, directors, principals, technical teams, and all participants from across the country. It is my privilege and pleasure to extend the vote of thanks on behalf of the ICMR and DHR on this inaugural session of the National VRDL Conclave 2025. First and foremost, I extend my heartfelt gratitude to Srimati Anupriya Singh Patel, Honorable Union Minister of State for Health and Family Welfare, Government of India, for gracing this occasion with her presence. She for releasing the validation portal and standard validation protocols, unveiling the VRDL bulletin, delivering an inspiring keynote address, and presenting awards to all 25 VRDLs. Her unwavering support continues to strengthen the network and empowers us to advance laboratory preparedness and research excellence. We assure you, ma'am, that we put all out efforts to make India future ready for healthy India. I sincerely thank Dr. Rajiv Bahal Secretary DHR and Director General ICMR for his insightful remarks that have guided us towards strengthening public health laboratory systems and building a robust framework for epidemic and disaster management. We really hope to see strengthened VRDL with some dedicated to IRDL and other national network as assured by DG ICMR under his leadership. I also thank Madam Anu Nagar, Joint Secretary DHR, for her warm approach and her continued effort in steering this network's vision and ensuring coordination across institutions. She made this network more effective and visible. I am also grateful to Dr. Rajiv Raghuvanshi, Drug Controller General of India, for his guidance and association with ICMR on various fronts, including protocol development, which were launched today. His collaborative approach is really helping the medtech ecosystem immensely. My gratitude extends to